Good morning. Thank you, Chairman. Thank you for the kind invitation. These are my disclosures. So the reason why the UK priorities for research and innovation should be applied everywhere is because regardless of the healthcare system that you look at, there's an enormous healthcare demand. And unfortunately, still nowadays, this is very much inpatient dependent. On one hand, we have an aging, comorbid population with chronic diseases, but we also have the younger, health-conscious and health-anxious population that require access to healthcare. There is an anticipated 30% demand surge expected for healthcare workers worldwide in the next decade, and the service delivery itself has changed. Not every outpatient appointment translates to an operation for surgical services. For the last 10 years, we've been forcing centralization. However, there is a lack of robust outpatient and community resources. So these are the three key areas that the UK is focusing on. Community healthcare, shifting the care from the hospitals to the community. This requires rapid diagnostics, digital pathology and radiology, telemonitoring and home-based care with decentralization to address healthcare inequalities. There's a shift for early detection and a focus from treatment to prevention, abiding by the screening principles, identifying the right treatment for the right disease stage, and targeting the treatments to those that are most likely to benefit. What I find the most interesting is addressing the efficacy-effectiveness gap. Understanding drug and treatment variability. Why is it that in more than 90% of medicines, they only work in 35 to 50% of people who take them? And we've seen this in vascular disease with platelet resistance, for example. So recognizing the importance of pharmacogenetics, understanding drug resistance, and addressing compliance. For all of this to happen, the healthcare system needs to be sustainable, resilient, and responsive. But of course, it requires a massive workforce expansion with AI and data science support. New government in the UK, as in the US, and Aradazi was called to write an independent review of the state of the NHS over the last years, and these are the highlights. Simplify and innovate care delivery, drive hospital productivity, and tilt towards technology. The workforce urgently needs digital systems and technology for breakthroughs to create new treatments. There has been an unprecedented increase in use of wearable technologies. The global market is set to reach 150 billion by 2027. And these are essentially sensors with a high processing powers and AI capabilities that give you a digital record of health parameters. Physical activity sensors, we know they're important, as per the Life Simple 7 from the HAA. Heart rate and rhythm sensors, which give you heart rate variability and are important for cardiovascular risk predictions. Blood pressure sensors. Biochemical sensors, biomechanical sensors, looking at wall shear pressure. Implants, of course, the smart stethoscope that won the award in the UK for actually being able to diagnose valvular disease. What's the evidence? So in terms of risk assessment, physical activity intervention, arrhythmia detection, heart failure diagnosis and management, and pre- and rehabilitation, there is good evidence that actually these systems are better than center-based rehabilitation. We published this paper almost 10 years ago on the use of wearables for short-distance claudicants that were actually able to triple the walking and claudication distance with a wearable sensor intervention. That result was sustainable at 12 months. And since that time, there are now 6,000 publications in PubMed around wearable technology. The Future of Surgery document from the Royal College of England is a really good document. I urge you to read it. It focuses on which technologies will make the greatest impact, how will the delivery of surgery change, and focusing on the future surgical team, who will deliver the healthcare. Big data, robotics, genomics, and wearables all feature heavily. My tips for vascular disease are around aortic dissection management, smart stents for arterial disease, EVA and TIVA, SAC management and growth, diabetes and foot health, stroke, intraoperative guidance, and of course, pre- and rehabilitation. So in conclusions, ladies and gentlemen, remote and digital technologies can reshape care delivery within a robust regulatory framework. We've seen the shift from hospital to community care. We've seen the shift from treatment to prevention. The public is using wearables, whether we like it or not. Everybody in this room will have one. Clinical validation is mandated. It's important to determine what is actionable data versus noise. And there's a requirement for these systems to be fully integrated into the healthcare delivery. More importantly, they're important for workforce transformation, for those people that will deliver the care in the community and in hospitals to release surgeons to be able to do what they do best, surgery. Thank you for your attention.